It's Monday, June 21st, 2021. I'm Jonathan Lowe, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. So today, we're going to be reviewing an article that was published in June of 2020 that comes to us from Italy. It's entitled Ozone Therapy in Veterinary Medicine, a Review. This is one of my favorite recent articles because it does a great job at summarizing some of the things that are just really cool and very critical for understanding ozone therapy. So let's dive in and take a look at the article itself. To start with, here in the abstract, it says, although O3 is known as one of the most powerful antioxidants, it also promotes antioxidant enzymes. Additionally, it stimulates some of the cells of the immune system and inactivates pathogens, including bacteria, fungi, yeast, protozoa, and viruses. Wow, that's a good list of things that it's going to work against. As we go down into the introduction, we read this: O3 can be considered a prodrug, as it can induce the activation of a second messenger in a cascade with multiple systemic actions and consequent rearrangement of the biochemical pathways. So a prodrug doesn't actually do the work itself. It stimulates a cascade of downstream effects. And that's kind of what ozone therapy is doing here. It began over 150 years ago. So that's incredible that we don't know more about it, or it's not more commonly used. O3 can be administered via two main routes, systemic and the local route. We highlight that in our treatment guide. If you take a look at our treatment guide, we go ahead and categorize all of these administration methods under one of those two. So a local might be an injection. It might be an lavaging an eye infection. It might be, a rectal insufflation, possibly if you're treating something in the colon there. However, usually things like rectal insufflation and major autohemotherapy and subcutaneous saline are considered the more systemic administration routes. The only impractical route for O3 medical application is inhalation, owing to its pulmonary toxicity. So you don't want to breathe it in. It decomposes into molecular and atomic oxygen with a half-life of 40 minutes at 20 degrees Celsius. So at normal room temperature, you're going to have about 40 minutes before half of that is gone. I like this little graphic here, and I wanted to read this real quickly. The oxidative mechanism of action of ozone. So really, basically, you have O3 that's reacting with unsaturated fatty acids. It's producing hydrogen peroxide, or H2O2, and it's also producing 4-HNE. These are converting NRF2, various types of antioxidants and immune cells that are being stimulated during that process. We don't have time to go into that. The change, it says, in O3-induced NO is also an important step, as NO plays a fundamental role in the physiological control of immune response. So when we talk about ozone therapy, it is stimulating an immune response. That's a really important part of it. It's stimulating antioxidant production. Thirdly, it inactivates pathogens. We all know that. The oxidant activity of O3 is useful for destroying bacterial walls, fungi, cytoplasmic membranes. However, it still acts against yeast, protozoa, and viruses. It's synergistic with antibiotics. I think that's kind of cool. We can keep that in mind and not be afraid to use it there. So there's lots of different animals that it's been used in. This is just highlighting a few. Treating mastitis is a great way to use it. It was used to prevent metritis in one study. In horses, it was reportedly used to improve antioxidant capacity before exercise. So kind of racehorses, that was kind of a cool thing. It's been used in orthopedics to cure osteoarthritis all the time, in combination, of course, with prolotherapy and PRP, etc. as well. It has an analgesic effect, to inhibit pain. And finally, it says this: medical use of O3 is based on its antioxidant, immunostimulant, and antimicrobial activities. In particular, where O3 is administered to elicit its antibacterial, antiviral, antifungal, anti-yeast, and anti-protozoal effects, no residues are found in tissues and biological fluids after its administration. I hope this was helpful.